In March 2006, a woman who gives the pseudonym Annie makes a statement in Washington, D.C., here, to a newspaper called the Epoch Times, saying that her ex-husband, between 2001 2003, had been harvesting the corneas of Falun Gong practitioners in Sujiatan Hospital in Shenyang province in China, and that other doctors in the hospital have been harvesting other organs, and that these Falun Gong practitioners were being killed through the organ extraction, and the organs were being used for transplants, which were being sold to transplant tourists. The bodies were cremated. I mean, that's what she told. She made a public statement to that effect. The government of China denies this, and so the question becomes: is this true? Is it not true? The Coalition to Investigate Persecution Against the Falun Gong, which is a non-governmental organization headquartered in Washington, D.C., comes to me and David Kilgore and asks us to investigate this. David Kilgore and I were not then and are not now Falun Gong practitioners, but were then and are now very active in human rights, researching, writing, advocating, volunteering, doing whatever we could, in a wide variety of areas, not just in China. I'm a lawyer in private practice in Winnipeg doing immigration refugee law, and through my refugee work I've got involved in a wide range of human rights refugee issues. David Kilgore is a former member of Parliament in Canada, former member of the Canadian government, former Minister of State for Asia and the Pacific, and at the time he retired was the longest-serving parliamentarian in Canada, along with one others. So the coalition comes to us, says, will you look into this? And of course, because I've been involved in human rights for many decades, I get a lot of requests like this. And normally what I would say is go to Amnesty International, go to Human Rights Watch, go to court. But this was something I couldn't really say no to. Because for a number of reasons. One is that because of my familiarity with human rights organizations, I couldn't see them doing anything very much about this. The issue presented an evidentiary conundrum. The human rights organizations tend to go for, I mean, they're largely campaigning organizations, and they tend to go, in terms of evidence, for quick fixes, something that's obvious very easily. But here what we have is, I mean, according to the allegation, true or not, the allegation is victims are dead and bodies cremated. So there's no surviving victims. There's nobody could say this happened to me. There's no corpses for autopsies. We have a crime scene, which is a hospital operating room, cleaned up immediately after the operation. So there's no crime scene. Hospital operating rooms can't get people in off the street wandering by to see what happens. No witnesses. Documents are all Chinese hospital documents, which are not available to public, not available through access to information, no documents. So how do we determine whether this is true or not true? I mean, we begin, at least I begin, on I should say the coalition that had asked us to investigate this. They didn't pay us any money, not even our expenses. They didn't give us any information. They didn't give us any directions. They just asked us. But I felt because this was something that required some looking into and wasn't that easy, and maybe it was something I could contribute to, I would give it a try. Because as a lawyer, I'm used to dealing with hard evidentiary issues. I mean, as a refugee lawyer, I'm used to dealing with refugees who come from a country with nothing but the clothes on their back. They tell you this story. Is it true or is it not true? They don't bring documents. They don't bring witnesses. But some of those stories are true, and some of them are not. So I'm used to sorting this sort of thing out. And so I figured maybe this is something I could do, and the established human rights organizations were not likely to do. But I start off, and so I say, yes, I'll do it, but I start off with the hope, at least, it's not true. I mean, I had no real presumption that it was true. In fact, I would rather to think more of humanity than not, that people are being killed for their organs. David Kilgore and myself, we started thinking of both ways in which the allegation could be proved and ways it could be disproved. We started developing trails of evidence, trails of proof, trails of disproof. And what we came to the conclusion after running through all these various trails of evidence. The trails of disproof went nowhere. The trails of proof gave us something, and we came to the conclusion after all was said and done that this indeed was happening. Not just between 2001 and 2003, the period, 2003, 2005, which is the period Annie was talking about, but from 2001 to when our report came out, not just in Sujiatan, but throughout China, not just for organs, not just for corneas, but for all organs. So that was our report. The first version of our report came out in July 2007. We then started a campaign traveling around the world to try to end the abuse that we thought we'd identified, speaking at different places, different countries, different cities, all around the world. Got more evidence, saw more witnesses, did a second version of our report, January 2007, and the third version, which is this book, came out in November 2009. Each of them updates the previous report, provides more evidence, and talks about the changing situation, the changing statistics. Now, the book itself has two parts. One is the evidence, and the second part is the analysis. You really have to go through the report or the book to look at all the evidence, and it is all the evidence that led us to our conclusion, and not just one bit of it. But let me just give you one example. One of the things we did is we had callers calling into China to various hospitals, investigators, Mandarin speaking, pretending to be relatives of patients, and asking the hospitals if they had the organs of Falun Gong practitioners for sale. Asking these questions on the basis that Falun Gong is an exercise regime, the practitioners are going to be healthy, their organs are going to be healthy. And we got admissions throughout China, which we had taped, transcribed, translated, got phone records, pick up the call down. And people saying, yes, we have these organs for sale. Now, I mean, one of the things that reinforced us in our conclusions as we went along is the frivolous way in which the Chinese government has responded to our report. And one of the things they did is they actually produced a documentary to try to rebut our report. And one of the things they did is they interviewed some of the people our callers talked to. And one of the people they interviewed was Lu Guoping. And we've got a tape and transcript of in translation what Lu Guoping said. And basically he says, well, we used to have these organs, we don't have them anymore. You should go to this doctor in this hospital, he still has them. And that was the nature of the conversation. And he said, you know, when we had them, I would actually go to the prisons myself to pick out the Falun Gong practitioners for sources. So the Chinese government produces this documentary, and they interview Lu Guoping. They hand him the transcript that we produced, and they say to him, get the call, did you say this? And he says, I got the call, looks at the transcript, he says, yeah, I said most of this, but there's a few things here I didn't say, and picks out a few sentences here and there. Basically the sentences that have to do with Falun Gong, suggesting we fiddled with the transcript. But what the video doesn't acknowledge is that we actually have a tape in his own voice, interwoven seamlessly, the things he admits having said and the things he denies having said. And, of course, no explanation how we possibly could have done that. So, I mean, it just isn't a credible explanation. Anyhow, that's one bit of evidence amongst many. Since we began our report and began our campaigns, there's been a lot of changes in China. When we started, we were dealing with what was essentially a transplant tourist market. Hospitals would advertise on websites. They would have price lists. They would have boast short waiting times. They would talk about how much money they were making from organ transplants. All that's gone. It's all been taken down. And it's archived, so you can see it on our website if you want, but you can't see it through Chinese computers. but the Chinese government hasn't just taken down all this information. What they've done is they've shut down the transplant tourism. They've articulated a policy that organs preference is to be given to Chinese patients over foreign patients, so in effect the demand supply of the market has been solved since our report came out, but not the supply side. The Chinese government, when we started, was saying organs came from donations, even though there was no donation system in China. They've instituted a donation system in August of last year as a pilot project in 10 cities, but it's still a very small part of the organ sourcing.